In this video you will come to know about the tests to diagnose, identify, diabetes. You will also learn how to check your diabetes at home by using Glucometer. Which tests are performed to diagnose diabetes? Anyone who has symptoms of diabetes should be tested for the disease. Diabetes is diagnosed using the following tests. A1C test. This blood test, which does not call for prolonged fasting, reveals your average blood sugar level over the previous 2 to 3 months. It calculates the proportion of blood sugar that is bonded to hemoglobin, the protein that carries oxygen in red blood cells. A test for glycated hemoglobin is another name for it. The more hemoglobin with sugar links you have, the higher your blood sugar levels will be. You have diabetes if your A1C result is 6.5% or above on 2 different tests. If your A1C ranges between 5.7% and 6.4%, you have prediabetes. 5.7% or less is regarded as usual. Random test for blood sugar. At some random time, a blood sample will be obtained. If your blood sugar level is 200 mg per deciliter, 11.1 mmol/L, or above, it shows diabetes. Fasting blood sugar test. You won't be allowed to eat anything the night before, and then a blood sample will be taken, fast. It is normal to have a fasting blood sugar level less than 100 mg per deciliter, 5.6 mmol/L. Prediabetes is defined as having a fasting blood sugar level between 100 and 125 mg per deciliter, 5.6 and 6.9 mmol/L. You have diabetes if it is 126 mg per deciliter, 7 mmol/L, or above on 2 different tests. Test for glucose tolerance. You must fast the night before this test. The level of fasting blood sugar is then determined. After consuming a sugary beverage, blood sugar levels are checked every 2 hours. It's usual to have blood sugar levels under 140 mg per deciliter, 7.8 mmol/L. After 2 hours, a result of greater than 200 mg per deciliter, 11.1 mmol/L, indicates diabetes. You have prediabetes if your blood sugar level is between 140 and 199 mg per deciliter, 7.8 mmol/L and 11.0 mmol/L. How to check diabetes at home using a glucometer. Set the glucometer to on by inserting the testing strip. Place the lancing tool near your fingernail and pierce the side of your finger, or another recommended location. When your finger has generated a large enough drop, release the squeeze. Put the blood droplet on the strip. Let the glucometer get a reading for a few seconds. If you want to know more about diabetes, then click a link given in a description below.